Healthcare is a team sport. We can't take good care of patients if we don't work together as a team. And so interdisciplinary education, doctors, nurses, clinical psychologists, social workers, we have to work together to put the best team on the field and give the best care to patients. That's true whether you're dealing with a chronic disease patient, a well baby check, or exploring and finding serious potential problems affecting the lives of the patients we care for. So that here at USU, we believe that team teaching and interdisciplinary education, graduate nurses, medical students, other healthcare professionals, not just practicing together, but learning to practice together, training together, teaching one another the skills and expertise that each group brings to the table is a fundamental part of learning to be a stellar healthcare professional and a stellar military officer. You and I both know that on the battlefield, a fight is won or lost by whether unit cohesion is maintained and everybody plays their role and looks after the person to their left and their right. It's no different in a clinic. It's no different in a house call. It's no different in a hospital. It's the way healthcare should be practiced. And here at USU, it's the kind of practice we aspire to teach, reinforce, and ultimately see all of you take forward.
Do you want to do anything on sexual assault?
Yeah. Okay. I just didn't know if
Yeah,
you
go
needed a
ahead.
break between them. Okay.
I will. I'll splice it.
Oh, okay,
And I'll
good.
take that part out.
All right. Yeah, and you can cut it. Yeah.
Yeah.
Okay. Sexual assault is not a topic that most medical schools or nursing schools spend much time talking about or teaching about. It's one of those issues we almost don't want to believe doesn't happen, but of course it does happen. It can happen to any individual at any time in their life, regardless of their social standing and regardless of the institution or organization they're in. So for us as healthcare professionals, doctors, nurses, clinical psychologists, we all have to have the core skills to ask questions, to listen attentively, to pick up on nonverbal as well as verbal cues, and to know what to do with the answers we hear. And so this topic is as important as understanding how to manage diabetes, heart failure, a gunshot wound, or any of the other conditions that we at USU teach our students to deal with. It's a fundamental part of modern practice. It's a fundamental part of doing your job. And it's something that we want every one of our graduates to feel comfortable and confident that they can handle appropriately, sensitively, and effectively when they're called to.